Houston is home base for Dr. Thomas P. McHugh and his large family of 7. His wife, Catherine, deftly manages their extremely successful practice, which caters to Greater Houston and the Woodlands. His passions are balanced and often intertwined between his family and his practice. In both environments, his calm, generous nature abounds. Dr. McHugh brings this thoughtful and methodical approach to all of his cases. In this segment, Dr. McHugh addresses what you need to know about liposuction. Widely covered in the media, many misconceptions exist about liposuction. The American Society of Plastic Surgeons states that liposuction is a procedure which vacuums out fat from beneath the skin surface to reduce fullness. This fullness is a result of fat, but generally speaking, men and women distribute fat differently.
Now, when we look at liposuction for different patients, it can be different between male versus female areas. Men don't get pregnant, so they don't have their skin stretched out across the belly. So generally, most men will do liposuction across the belly, across the chest, across the love handle areas to get the better shape to the torso. On women, their influences are different too, between hormonal, but also because of pregnancy, they'll distribute fat in different areas.
Patients that are generally physically fit with pockets of fat are good candidates for liposuction. Liposuction is indicated for sculpting the body, not for weight loss. Dr. McHugh always approaches liposuction with the end result in mind.
Liposuction will take out the extra fat, allow the extra skin that would be to contour down to the shape of the body. Because what I always try and tell people is doing liposuction is like we do work on the nose. If you work on the nose, you work on the bone, you work on the cartilage. The skin is like a tablecloth that reshapes over those structures of the nose. You don't do much of anything to the skin. When we do liposuction, yes, you're taking out the extra fat, but you want that skin to re-drape to the shape of the torso after you've done the alteration underneath, just like you do with the nose.
Beyond traditional liposuction, several variations of the procedure are available depending on the specific needs of the patient.
Laser liposuction is a method too, using what we call a YAG laser to break down the fatty tissue through very small incisions, and then to remove that fat with a very small cannula, generally called smart lipo. Smart lipo is just that, is that you inject fluid beforehand, put a small laser underneath the skin, break down the fat, and then evacuate the fat with liposuction through very small pinhole type incisions. Generally will give a little bit better skin retraction and also can give a little less bruising and very similar recovery to regular liposuction.
Dr. McHugh expertly sculpts the body, giving patients the beautiful silhouettes they desire. Ask your doctor which procedure is right for you.